Somewhere beyond the sea, somewhere waiting for me. My lover stands on golden sands and watches the ships that go sailing. Somewhere beyond the sea, he's there watching for me. If I could fly like birds on high, then straight to her arms, that
Trying to rain on the thunder. Tell the storm I'm new. I'm a walk, I'm a march on the regular. Ain't no white flags blue. Love forgive me, I've been running blind and true. I'm a rain on this bitter loss. Tell the sweet I'm new. I'm telling these tears going fall away, fall away. Oh, may the last one burn into flames. Freedom, freedom, I can't move. Freedom, don't be losing. Freedom, freedom too. I break chains, I want to and freedom in there. Lupe, would you like to do the honors? Good morning, everyone. How are we doing? How are we feeling? Yes, getting some breakfast, coffee, getting situated. We're so excited to have you all. Good morning again. My name is Guadalupe Martinez, pronouns are she, her. And on behalf of my really good friend and co-chair, Dr. Marissa Coleman, pronouns she, her, and this year's planning committee, I'm deeply honored to welcome all of you, whether you're joining us in person or virtually, to the 2024 Health Equity Summit. Right. Last night, we kicked off the summit with an incredible poster session and reception, thanks to all of those who presented. We are so excited to build off on the energy from last night with all of you today. And as we get going, we'd like to take a time to acknowledge a few things. The UVM Health Network acknowledges that we live and work on Wabunacook, the historical and current homeland of the Abenaki peoples, and Ganyonge, the historical and current homeland of the Mohawk peoples. We recognize the long history of genocide and land theft used to create what we know as the state of Vermont and the state of New York as a part of the United States of America. We commit to our shared role in land stewardship and seeking the voices and needs of Indigenous peoples. We also acknowledge the history of slavery and the rich contributions of African descendants for more than 400 years. We acknowledge the exploitation of labor for economic growth and our responsibility to address labor inequities that exist today. We carry our ancestors in us, and we are continually called to be better. This acknowledgement is one of many essential steps towards our commitment to create an inclusive environment of care for our staff and our communities. Additionally, we would like to acknowledge that there's a lot going on in the world right now. We recognize that these are perilous times for many people all around the world. And we come together today to learn how we, both individually and collectively, can be better stewards of peace, healing, and hope. Our collective liberation is dependent upon us seeing and valuing our shared humanity. By the end of your summit experience, we hope that you will be inspired to act in ways that help build sustainable partnerships that lead to wider avenues for health equity locally and around the world. This year's theme is building solidarity, sustainable pathways towards health equity, and we are humbled to be able to highlight the incredible work so many in our community and so many of you here today are doing to address health equity. We believe health equity is a state in which everyone has a fair and just opportunity to attain their highest level of health. And we know that it will take all of us working together to achieve this state. Today's summit builds on the previous two summits
Many people came together to plan the summit, and we want to express our deep gratitude to all of the members of the planning committee. So if you're on the planning committee, please stand up so we can recognize you.
Woo! Thank you so much.
Thank you so much. From the bottom of our heart, we're deeply grateful to you all. Additionally, we're thankful for the staff here at the DoubleTree Conference Center, our volunteers today, and all of the people behind the scenes that have helped make this vision a reality. Lastly, we'd like to publicly thank all of our sponsors for their generous support of this year's summit. So, clap for them.
This year, we have a diverse group of presenters speaking about a wide variety of topics related to health equity, from the intersections of food security and healthcare, to gender-affirming care and fostering accessibility, to addressing racial disparities in healthcare leadership. We hope there is something for everyone here today, and we hope what you experience today inspires you to action. It is now our pleasure to play a message from UVM Health Network's president, Dr. Sunny Eapen, who will share a few welcoming remarks for all of us today.
I want to thank everyone who've worked so hard to make this summit happen today, and everyone who's participating. By coming together to share your knowledge, your concerns, and your passion about this issue, you're making a statement about the importance of health equity in everything we do. As a health system, we serve more than 1 million people in our health service area. We know we have a responsibility to provide care that is high quality and accessible while creating an exceptional experience. But none of this is possible unless we also provide equitable care. Recently, and for the first time, we've created a multi-year strategy for diversity, equity, and inclusion across our health system. It includes action steps to support our goals. In that strategy, we commit to working together to ensure everyone has an equitable and just opportunity to be as healthy as possible. We also commit to creating an environment where our patients receive the care they need while feeling seen, safe, and heard. We have to recommit to those goals every day because we'll always encounter new challenges and obstacles to achieving health equity for our patients. We can, and we must, measure the progress we're making. That's part of the work we're doing now. But the work of health equity will never truly be finished. That's one reason why I appreciate the theme of this year's summit, which talks about sustainable pathways towards health equity. I believe we're on that path. It will take all of us and many more partners who aren't here today to ensure that the progress we're making is a sustainable one. Thank you for everything you're doing to keep us moving together toward greater health equity. Thank you for being here, and I hope you have a wonderful and educational day.
Now, please join me in welcoming UVM College of Nursing and Health Sciences Dean Dr. Noma Anderson and UVM Larner College of Medicine's Dean Dr. Richard Page to the stage to share what health equity means to them.
Thank you very much. Dean Anderson told me I should go first. So I'm going first. I want to welcome everybody and just say hello and greet you from the Larner College of Medicine here at the University of Vermont. My name is Rick Page, and it's really a pleasure for me to be here with you today. I want to congratulate the organizers. What an amazing operation is going on here. What an amazing evening last night, I understand, and today so many members of the community. It's really wonderful to see you all here. And congratulations to Marissa Coleman, who initially had this idea and she did not let go. And here it is, bigger and better than ever, the third installment of the Health Equity Summit. I think we should give her a round of applause. Sorry, Marissa, I did not have permission to do that. At the Larner College of Medicine, we emphasize professionalism, and we define it as including and treating everyone we interact with cultural humility, kindness, and respect. This is fundamental to providing health care for all, and we can't have health without health equity. I want to acknowledge the Office of Diversity, Equity, and Inclusion within our College of Medicine, led by Dean Margaret Tando, Ms. Tiffany Delaney, and Ann Doherty, who leads in terms of gender equity. Now, the Larner College of Medicine has a special place in terms of the healthcare ecosystem of our community. We interact very closely with the health network, especially the University of Vermont Medical Center, but all of the partners within the health network. Our clinical faculty, our medical students, our staff are engaged in the greater healthcare community, and you saw some of the students' activities last night in the posters, and are part of the University of Vermont. And at UVM, likewise, we straddle between healthcare and the university, and working very closely with Amer Ahmed, the Vice Provost for Inclusive Excellence. So in closing, I'm just thrilled to be here. I shouldn't say I wish I didn't have clinic going on at 9:30. I love seeing my patients, but I wish I could be able to stay with you longer today. But I do congratulate the organizers. I thank you for allowing us to be partners. And speaking of partners, I now have the opportunity to introduce and pass the microphone off to my partner in terms of healthcare and health sciences at the University of Vermont. Dean Noma Anderson, seems like you've been here forever, been here 3.5 years, and who's counting, and has been such a wonderful partner to me in the Larner College of Medicine. She serves as Dean of the College of Nursing and Health Sciences, and I know she wants to share her words today. Please join me in welcoming Dean Noma Anderson.
Thank you, Rick, and good morning, everyone. As Dean of the College of Nursing and Health Sciences, it is an honor to have been asked to provide this welcome. The mission of the College of Nursing and Health Sciences is to prepare students to be global citizens who lead and advance equity in support of the health of individuals, communities, and societies. The values of the college are health equity, respect, advocacy, compassion, integrity, and inclusion. Our college is committed to the objectives and the purposes of the 2024 Health Equity Summit. This summit is a remarkable annual event. UVM and UVM Health Network host this gathering of healthcare providers, students, community agencies, researchers, nonprofit agencies, faculty, and individuals from Vermont, New York, and New Hampshire, who are committed to the attainment of the highest levels of health for all. But there's a lot of work to be done to eliminate health inequity. In 1966, Dr. Martin Luther King Jr. said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." Dr. Donna Christensen, former U.S. Congresswoman representing the U.S. Virgin Islands, is the only woman physician ever elected to Congress. Dr. Christensen has said, "Physicians know how to treat diseases. We know how to keep people well, and we now understand a lot about the social and economic and environmental determinants of health. But to change those, you have to put people in office on every level, federal, state, local, who share those concerns, understand those issues, and want to do something about it. Who you vote for is critical." End of quote. As chair of the Congressional Black Caucus Health Brain Trust, I'll close with something else that Dr. Christensen said. She stated that health disparities is the civil rights issue of the 21st century. I, along with the students, faculty, and staff in the UVM College of Nursing and Health Sciences, welcome you to the 2024 Health Equity Summit. Thank you.
Wow. Thank you so much, Dean Page and Dean Anderson. I want to thank all of the leaders that are present here today, the leaders that have spoken. I want to give a special shout out to one of my leaders, Dr. Steve Leffler, who believed in this vision from the beginning and has supported it with unwavering commitment. Thank you, Steve. We appreciate all of your support and all you do to promote health equity here at the College of Medicine, the College of Nursing and Health Sciences, the UVM Health Network, and in all of our communities. It is my pleasure to introduce Dr. Carla Carton, the University of Vermont Health Network's Chief Diversity and Inclusion Officer, who will then introduce our opening experience. Dr. Carton, who uses she, her pronouns, has over 25 years of experience in the fields of strategic planning, diversity and inclusion, health equity, and change management, and has spearheaded the DEI departments at Mass General Brigham, UMass Memorial Healthcare System, and Cleveland Clinic, to name a few. We are thrilled to have her lead the DEI work at the UVM Health Network. And I'm going to go off script here for a moment and just share that Carla is a leader that if you are fortunate enough to interact with and to cross paths with, you will walk away feeling cared for. You will feel the compassion that is a part of everything that she does. And she's been an incredible model to our team. Dr. Carton, will you please join us on the stage?
Thank you, Dr. Coleman, for that wonderful introduction. It is a pleasure to be here with you today. It is a pleasure to be in this community. I have been here on the 13th, which is just next week. I'll be celebrating my 5th month as part of your community. And in that community so far, I've been experiencing what I've been calling a consistency. Many of you have heard me say this a couple of times, but it has just really struck me that anywhere I go, I'm picking up a couple of themes. And one of the themes is people coming together to build community. But when we come together, we take the time to stop and listen. We listen to each other so that we can build trust. And that through that trust, we can build relationships. And then through those relationships, we can build collaborations. And then through those collaborations, we can set forth and do the work that we have come together to do. And it is just a thrill and an honor to be a member of this community and to be part of this healthcare summit, the 3rd annual healthcare summit. When I arrived last night and I walked through and saw the poster presentations, I was blown away. I was just blown away because this whole experience is an opportunity for our community to come together and talk about the different projects and the different work our community members are doing. And not too many organizations or communities or places across the country take the time to bring communities together, to listen to each other, to hear what work is taking place, that we can then learn from each other and then start building those relationships. When I saw the poster presentations, again, I was blown away. We've got such wonderful, thoughtful, intellectual, I don't want to come up with another word because it's about to sound too corporate, but we just have such great brain power and such good, wonderful humanity that's bringing us together to really focus on what is the work that needs to be done so we can offer equal access to care and culturally intelligent, competent care in an equitable manner. One of the things I was asked to do is just spend just a little bit of time saying why health equity is important to me. When I was doing my doctoral research, I went to Africa, Asia, and Latin America. And I was working with organizations that were non-governmental NGOs, non-governmental, it just went out of my head. Organizations, non-governmental organizations. And these were grassroots organizations that were really coming together and working with an organization I was representing at the time, which was a Western organization. And the whole mission was to see How can we bring resources and intelligence from the West and put it in relationship with resources and intelligence from the indigenous groups that were working in these communities? As many of you know, most of the time it's the West coming in and doing the hand down. We've got all the intelligence, all of the resources, and we're going to help the poor people around the world. This whole mission was to change that paradigm. And in that paradigm, I started doing a lot of research and recognizing that there were so many healthcare disparities across the globe. But when I came back to the United States, I recognized there were a lot of healthcare disparities in my own backyard. I'm from Ohio. And when I was doing my research, I realized that Youngstown, Ohio, Northeast Ohio, where I'm from, had one of the highest rates of infant mortality in the country and was significantly similar to some of the communities in the developing world. And I was like, how can this be? More research. And this research led me to recognize and start owning my own life experiences, that if I go in for healthcare, and let's say my best friend is with me, and my best friend looks just like me, except she's in a white body and I'm in a black body. We've got the same education, we have the same language skills, we have the same accent, same socioeconomic status, same education. The healthcare will be different. The questions she's asked in her healthcare interviews will be different. The treatment plan that she will receive will be different. Our health outcomes will be different. Statistically, that is true. Further research brought me to realize that in the last 15 years, white, rural men, middle-aged and older, are trending down in their healthcare outcomes because of access to good quality healthcare. Health equity affects all of us, absolutely all of us in this room. And I'm about to just like wrap my story up because I was told I had maybe 2 minutes and I know that I'm going over. But I do want to share one thing because this was the tipping point for me. And when you get to the tipping point of where do you want to spend your life energy? Many of you know I have a son. I have 2 sons. One of them is Daniel. Daniel's going to turn 22 on October 13th. Daniel is really well rooted on the autism spectrum. When Daniel was about 2-3 years old, I did everything in my power to make sure he was getting all of the access to care that he needed. Every week, I took him to our children's hospital for different treatments and therapies. Twice a week, I went to the children's hospital. And every Monday, it was Monday and Wednesday, and every Monday they would give me the form and I had to verify all of the information on the form. And part of me was like, why do I have to do this every single week? But what was more curious than that was on this form was demographic data. And Daniel is fair. I would always put in Daniel is Black, African American. And I'd get the form back to verify it, and it would say that Daniel was white. And I'm like, well, this is curious. So every week I'd change it. The third time it happened, I went to the receptionist and I said, I know how important this demographic data is. And I'm going to do a shout out also. I know how important this demographic data is. So if you're in an organization that asks you for your demographic data, please fill it out. Because people like me then have access to data so we can track and see, are we providing equitable care? Are we providing equitable opportunities for progression throughout an organization? Anyway, I won't go on a lecture, but please do your demographic data. But anyway, so I went to the receptionist and I'm like, okay, this is week 3 and I keep changing this on the form. And she's like, so she's behind the booth. And so I'm leaning in and she's like, Dr. Carton. And I'm like, you can call me Carla. She's like, Carla, I'm actually doing you a favor. I'm like, what? And I said, a favor? I mean, I was just kind of getting kind of freaky. But I was like, okay, we just need to change this because Daniel is not white. I'm his mother. You can look at me. You know I'm his biological mother. If I'm Black in this country and with pride, Daniel is Black. And she was like, well, it's not the system that's broken. I change it for you. And I'm like, why would you do that? And she said, if I put that he's white, he'll get better health care. My immediate reaction for you that sign is like, WTF? But I was like, what? And she's like, he'll get better health care. And I'm like, that doesn't even make sense. I'm like, I'm walking with him. He can't leave me. So I'm walking with him through all of these therapies. People can see that if he's got a Black mother, that he's going to be a Black child. And she's like, oh, but one, they might forget. And I'm like, two, even if they don't forget, if it's in the form, that form goes through all kinds of processes and it affects your insurance. So believe me when I tell you, it's better to have him be listed as white. I don't need to tell you how many red flags were going up for me. As a researcher, as a mother, as a person who, at that moment in time, that's when the shift happened. And I'm like, I am in this to win it. We have got to really look at the systemic issues that undergird systemic racism in our healthcare systems that really impact health equity, and health outcomes. So when you ask me to talk for 2 minutes, always allow me 4. And I just want to say that I am just elated to be here because one of the reasons I came to Vermont is knowing that people stop to listen, they build trust, they build relationships, collaborations to actually impact the work that will move the needle in the health equity space. And that's what you all are doing here. We are moving the needle. You all have been moving the needle. And I'm just honored to be a part of the team working with you now.
Wow. Thank you. Thank you so much to Pillsbury House Theater. That was such a gift. So, wow, we have to transition and I am just like, I almost at a loss for words. So what I'm going to do is I'm going to share the little piece that I was able to draft for I Am From. And I hope that all of you will share that with somebody else that maybe wasn't at your table or that you will continue the exercise. I am from salty seas and sugary lefse, from tell me one more story to drowning myself in books to feel less alone. I am from the three little birds singing not to worry, to riding big dreams to the nearest big city. I am from the middle.
Thank you. Thank you, Marissa. That was beautiful. And I hope you all really enjoyed sharing your I am froms. And I hopefully you're able to take it with your own family, friends, and community to continue sharing your story because it matters. So thank you so much again to Pillsbury House Theater for that powerful, inspiring, and brilliant performance and conversation about how we can work together towards health justice. If you need support, we know that this can be quite a bit. And we heard even at our own table how folks were really resonating, but also how it impacted them. So our employee wellness team is just outside of this room, of these doors, and they are available to offer support for further discussion about the content portrayed in this performance. In a few minutes, we'll take a break for our first concurrent session of the day. But before we do, there's just a few more things we'd like to go over with you all. As we've mentioned, today's schedule highlights the amazing work that many people have been working to address different aspects of health equity. And the whole sessions today will take place in these 2 floors, and including in this room as well. And by participating in this year's Health Equity Summit, you're eligible to earn 5.5 continuing education credits. Information on how to claim your CMEs will be emailed to attendings following the summit. And with the overwhelming interest in this year's summit, we would like to ask all of you to please be mindful of room capacity when attending these sessions in person. Once a session's capacity has been met, our volunteers will kindly ask you to please join a different session where space permits. And please note that all of today's sessions are hybrid and will be recorded. So if you're unable to attend a session, but you'd like to view the content later, it will be available following today's sessions. For volunteers who can be identified by their badges, are here to assist you. They will be here to assist you throughout the day. And if you have any questions, please ask the volunteers. The program is displayed at large monitors on the entrances on both levels, and each breakout room has a monitor by the entrance showing the concurrent session as well.
Additionally, one of our key goals from the beginning has been to make this summit as accessible as possible for everyone, whether attending in person or virtually. We have a diverse group of learners here today, and we kindly ask that you remain mindful of the unique needs. Please follow the platinum rule. Treat others as they would like to be treated. We deeply appreciate your support in making this a respectful and inclusive environment for all. Please note that cart services are available in the amphitheater, which is just through those doors, or here in the Lake Champlain Exhibition Hall. Some seats are marked as reserved for individuals who requested specific accommodations during the registration process. If you need an accommodation that you didn't request ahead of time, please reach out to a volunteer so we can support you. We also want to be considerate of individuals who may be immunocompromised. If you're experiencing any cold or flu-like symptoms, we ask that you please wear a mask or attend the summit virtually. Masks are free and available at the registration table. We encourage mutual kindness with diverse masking needs and preferences. Additionally, a lactation and chest feeding room and a low sensory room are available across the hall right through those doors for anyone who may need them. We also have a space for mindfulness and chair yoga outside the exhibition hall, which you'll see right through these doors to the right. We encourage you to practice self-care as needed. On the second floor, you will find gender-inclusive restrooms, while gender-specific restrooms are on the first floor.
We want to thank Chocolate Thunder security staff who will be present throughout the duration of the conference to ensure the safety and well-being of all attendings. You will notice that they'll be wearing black polos and will be available for you if you need to share any safety concerns at any time. We appreciate everyone's efforts to create an inclusive and safe space. And finally, we have several exhibitors who are set up on the second floor who would love to meet you all. We encourage you to take some time to learn about their organizations and the resources that they offer. Oh, and one more thing. Well, a few more things actually. If we can get a selfie with all of you, and we encourage you to share pictures using the hashtag HES24 today. So we'll take a quick
Humor
picture.
us millennials.
Yes.
If everyone wants to stand up and get together.
As much as you can.
That is far in.
Do you want to? Yeah.
Okay. All right. On a count of three, we're gonna say eight. What are we gonna say?
Summit.
Summit. Summit. All right. 1, 2, 3. Summit.
Thank you. Please go enjoy yourself. Thank you.